Segment 2. The death of Jesus. Was it real? Now the harder question, the one that rationalist scholars spent the 18th and 19th centuries on. Did Jesus actually die on the cross? Or did he survive? The Swoon Theory, popularized by German scholar Heinrich Paulus in 1828, proposed that Jesus merely fainted from exhaustion, was mistakenly declared dead, revived in the cool tomb, and escaped. For almost a century, it had serious academic traction. Then forensic medicine arrived. In 1986, the Journal of the American Medical Association, not a theological publication, a peer-reviewed medical journal, published a landmark paper on the physical death of Jesus Christ by Dr. William Edwards, a Mayo Clinic pathologist, alongside trauma surgeon Dr. Wesley Gable and chaplain Floyd Hosmer. They spent years reconstructing, from Roman historical sources and modern trauma medicine, exactly what crucifixion did to a human body. What they described is difficult to read. Before the cross, Jesus underwent Roman flogging, flagellatio, with a weapon called the flagrum, a leather whip with multiple straps tipped with lead balls and sharpened sheep bone. Roman flogging was calibrated torture, enough to destroy the body without killing, to ensure the victim was at maximum physical collapse before crucifixion began. The JAMA study confirmed that the level of trauma described produced hypovolemic shock, catastrophic blood loss triggering cardiovascular failure. Victims frequently lost consciousness before the flogging even ended. Then came the cross. The nails through the wrists, not the palms, because palms cannot support body weight, a detail the medieval artists always got wrong. The weight of the body collapsing onto impaled wrists, every breath requiring the victim to push up on the nail through the feet, fighting for lung expansion against the position of the body. Death by crucifixion is death by suffocation, slow, controlled, exhausting. Roman soldiers were trained executioners. They did not make mistakes about death, but it was the final wound that closed the medical debate. The Gospel of John records that when soldiers came to break the legs of those crucified beside Jesus, standard practice to accelerate death, they found Jesus already dead. So one soldier drove a spear into his side, and John records with striking specificity, blood and water came out. Not blood and water, separately. For centuries, this was treated as theological symbolism. Then modern cardiology explained it. Dr. Frederick Zugibe, chief medical examiner of Rockland County, New York, and the world's leading forensic expert on crucifixion physiology, identified the mechanism: pericardial effusion and cardiac tamponade. The severe trauma of crucifixion causes clear fluid to accumulate around the heart inside the pericardial sac. When the Roman spear pierced the right side of the chest, it would have exited the pericardial sac and the heart simultaneously, releasing two separate fluids: blood from the heart, clear fluid from the sac. A first-century fisherman recorded a cardiovascular forensic detail that medicine didn't name or understand until the 20th century. The JAMA study's final verdict, published in one of the world's most respected medical journals. Clearly, the weight of historical and medical evidence indicates that Jesus was dead before the wound to his side was inflicted. The Swoon Theory didn't die in a theological argument. It died in a medical journal.